Good morning and welcome back. I need you to stop what you're doing right now because what I'm about to share with you could genuinely change the way you sleep tonight and the way your legs feel tomorrow morning. In my 27 years of working with patients over the age of 60, I have never seen a topic more misunderstood, more overlooked, and frankly, more life-changing than this one. Most seniors I speak to have no idea that the position they sleep in every single night is either quietly helping their circulation or slowly making it worse. And the medical community, for the most part, has done a terrible job of communicating this. Here's what woke me up to this issue. A landmark study published by the Journal of the American Geriatric Society followed over 4,200 adults aged 65 and older for a period of 5 years. What they found was staggering. Seniors who consistently slept in positions that restricted lower limb blood flow were 67% more likely to develop chronic leg pain, swelling, and peripheral circulation problems than those who did not. 67%. That's not a minor difference. That is a health crisis hiding in plain sight in the bedrooms of millions of seniors across the country every single night. And before we get into our full countdown today, and I promise you, the number one position we're going to reveal is going to shock you because it goes against everything your doctor has probably told you. I want to pause and ask you something personal. Drop a comment below and tell me, how old are you? And do you currently wake up in the morning with any leg stiffness, tingling, or that heavy, achy feeling in your calves or feet? I read every single comment on this channel, and your answer today is going to help me create better content for you going forward. This community means everything to me, and I want to make sure I'm addressing exactly what you need. Now today we are going through 6 sleeping positions, ranked from least to most powerful in terms of their ability to increase blood flow in the legs for seniors. This isn't just about comfort. This is about your independence, your mobility, your ability to walk to the mailbox, play with your grandchildren, and live the life you deserve. So let's get into it, starting with number 6. Number 6 on our list is the flat back position with no elevation. And I want to start here because this is where most seniors begin. And it's important you understand why this position, while not the worst, is leaving a tremendous amount of circulation benefit on the table. When you lie completely flat on your back with no pillow support under your legs and no elevation of any kind, what happens to the blood in your lower extremities is actually quite fascinating from a physics standpoint. Think of your circulatory system like a network of garden hoses. When the hose is perfectly flat and the water pressure is moderate, water flows, but it flows slowly and it pools in certain areas. That's essentially what happens to your venous blood, the blood that needs to travel back up from your feet and legs toward your heart when you're lying completely flat. Now, for a 35-year-old, this is a minor inconvenience. The body compensates efficiently. But research from the University of Edinburgh's Cardiovascular Research Center tells us something critical about aging. After the age of 65, venous return efficiency, that's the technical term for how effectively blood travels back to the heart from your extremities, decreases by approximately 28 to 34% compared to young adulthood. And after 75, that number climbs even further. The smooth muscle cells lining your veins lose elasticity. The valves inside your leg veins, the tiny one-way doors that prevent blood from pooling downward, begin to weaken. This is why so many seniors develop what I call the morning shuffle, that first 5 to 10 minutes after waking up, where the legs feel wooden, heavy, almost foreign. Sleeping flat on your back without any modification doesn't actively harm circulation, but it misses a golden opportunity to use gravity as your silent circulatory assistant. I had a patient, Margaret, 71 years old from Tucson, Arizona, who came to me convinced she was developing serious vascular disease because of how heavy and swollen her ankles felt every morning. When I asked her about her sleeping position, she described exactly this: flat on her back, no elevation, nothing special. She hadn't changed that habit in 40 years. We started with very minor modifications, which we'll get to further up this list. And within 3 weeks, she told me her ankles looked and felt more like they did in her 50s. The lesson from number 6 is simple. Lying flat on your back is a neutral baseline. But for seniors who want to actively fight poor circulation, neutral isn't enough. Number 5 is what I call the curled supine position. And this one deserves a warning. This is when seniors lie on their back, but unconsciously draw their knees up toward their chest, or sleep with their legs bent at a significant angle throughout the night. Many seniors fall into this habit because it temporarily relieves lower back pressure, and it does. But here's what they don't tell you at the doctor's office. When your knees are bent at an angle greater than 45 degrees for extended periods during sleep, you are compressing the popliteal vessels. Those are the major blood vessels running behind your knee in a way that significantly reduces circulation to the lower leg and foot. A study conducted at Johns Hopkins University found that sustained knee flexion during sleep was associated with a 41% reduction in measured blood flow velocity to the lower leg, compared to a neutrally extended position. 41% from one small postural habit. For seniors specifically, this matters enormously because of something called peripheral arterial stiffness. As we age, particularly after 70, the arteries supplying blood to the legs become progressively less flexible. They lose their ability to dilate and accommodate varying levels of blood demand. When you add sustained positional compression on top of already stiffened vessels, you create a perfect storm for morning leg pain, cramping, and in more severe cases, the worsening of conditions like peripheral artery disease. I want to be very clear. I'm not saying this position is dangerous for everyone, but if you are currently a back sleeper who tends to curl your knees up, I want you to try tonight sleeping with your legs as extended and relaxed as possible, and notice the difference in how your legs feel when you wake up. A patient of mine, Gerald, 78 years old, from Baton Rouge, Louisiana, had been waking up almost nightly with severe calf cramps for nearly 2 years. His doctor had attributed it to dehydration and magnesium deficiency. Both are valid contributors, and we address those, but the missing piece was his sleeping position. Gerald, it turned out, slept every night in an almost fetal-like position on his back, knees significantly bent. Once we corrected his sleep posture and added a long body pillow to keep his legs extended, his nighttime cramping decreased by what he described as about 80% within the first month. Never underestimate posture. Number 4 brings us to the full side-lying position. Side sleeping is the most common sleep position worldwide, and for good reason. It has genuine benefits for spinal alignment, airway patency, and even lymphatic drainage. But when it comes to leg circulation specifically, the standard side-lying position has a very significant problem that almost no one talks about. When you lie on your side with your legs stacked directly on top of each other, one leg resting on the other, you are placing sustained compressive pressure on the lateral leg structures, including a major nerve called the peroneal nerve and the underlying vasculature. Over the course of a 7 or 8 hour sleep, this pressure accumulates in ways that restrict circulation meaningfully. The reason this matters, particularly for seniors, is the concept of tissue tolerance. Research from the Wound, Ostomy, and Continence Nurses Society, as well as multiple studies out of the University of Maastricht in the Netherlands, confirm that aging skin and underlying soft tissue have a substantially reduced tolerance for sustained pressure. After the age of 65, tissue can sustain meaningful compression damage in as little as 2 hours, far faster than younger adults. But you don't have to develop a pressure ulcer for this to affect your circulation. Even sub-threshold compression pressure that doesn't damage tissue outright is enough to measurably reduce venous return from the lower leg during sleep. The modification that transforms this position from circulation neutral to circulation positive is one of the simplest things I recommend to every senior patient I see. Place a firm pillow between your knees and lower legs. Not just between your knees, between the entire length of both legs, from knee to ankle. This single change eliminates the compressive stacking effect, maintains proper pelvic and lumbar alignment, and allows both legs to experience unrestricted blood flow simultaneously. A study from the Sleep Research Society found that side sleepers who used interleg pillow support reported a 38% reduction in morning leg discomfort scores compared to those who did not. Simple, zero cost, and you can start tonight. Now, before we continue to the top 3, which is where the most powerful and surprising information is, I want to take just a second to ask you a favor. If this video is helping you understand something about your circulation that you didn't know before, would you take 2 seconds right now and hit that like button? It genuinely helps this channel reach more seniors who need this information, and it tells me that I'm putting out content that's actually making a difference in your life. And if you haven't subscribed yet, please do. We put out senior health content every single week, and every video is designed specifically for adults over 60. Now let's keep going, because the top 3 are where everything changes. Number 3 is the elevated leg supine position, lying on your back with your legs raised. And this is the first position on our list that actively uses physiology to accelerate venous return in a clinically meaningful way. When you elevate your legs above the level of your heart during sleep, even modestly, you are recruiting gravity to assist the circulatory process in a way that no amount of medication can fully replicate. Think of it this way. Your veins are not like arteries. Your heart pumps blood out through your arteries with tremendous force. But the return journey, blood coming back from your feet and legs up through your veins, relies on a combination of muscular contraction, valve function, and yes, gravity. When you are upright during the day, your leg veins are fighting gravity constantly. Every moment of every walking hour, the venous blood in your lower extremities is climbing uphill. Sleep is the body's natural opportunity to let gravity assist rather than resist that process. A clinical trial published in the European Journal of Vascular and Endovascular Surgery studied 318 patients over the age of 65 with documented venous insufficiency over a 12-week period. Half of the group slept with their legs elevated between 15 and 20 degrees. The other half slept flat. The elevated group showed a 52% reduction in leg swelling, a 44% improvement in venous return velocity measured by Doppler ultrasound, and reported significantly lower levels of leg fatigue and pain. These are not trivial numbers. The practical implementation of this position matters enormously. Many seniors try to achieve leg elevation by simply stacking extra pillows under their feet. And while this is better than nothing, standard pillows compress and shift during the night, providing inconsistent elevation.